to Connect with Christina. Today, we have my friend, Dr. Briner with Connected Health Phoenix.
Hi.
How are you, Doc?
Doing good. How are you?
Amazing. I'm glad to be back.
Yeah, I'm glad you're back.
This amazing doctor here has taught me a lot with chiropractic care. And my favorite phrase that she's taught me is that chiropractic is more than just neck and back pain.
Yeah.
Can you please elaborate?
So chiropractic being so much more than just neck and back pain, I love educating that because only 4% of the nervous system is responsible for processing pain. So the rest of your nervous system controls literally every organ, tissue, muscle, function, cell in your body. So pain is always the last thing to show up and it's the first thing to go away. So someone could come to me and they don't have any discomfort or pain, which is great. We want to make sure that you don't get to that point. So I work on, and I base my recommendations not just on pain, because pain will come and go, but I want to work on the posture. So when someone has like horrible posture, everyone nowadays is hunched over from technology, looking down.
We all just got straight, okay.
Looking down at phones, computers, technology. So I want to like definitely work on that overall posture. So then that way things won't get that discomfort going forward. So I've helped people with like anxiety, allergies, asthma, like trouble focusing, even some blood pressure, digestive issues, thyroid. For me personally, I used to take reflux medication from like the 3rd grade all the way through like my first year of chiropractic school because I had no idea going into school that it was so much more than just pain, and now I don't take any medication at all. And even for me, like my cycle, I used to have horrible cycle, throwing up, like I don't have that anymore.
Wow. Are you guys listening to this? So like, I know there's so many of you that needs to see this doctor. And how about TMJ?
Oh yeah. For me too, like I get my jaw adjusted as well. And it still is a work in progress, but it is so, so important to get your jaw adjusted and the upper neck as well. So
yeah, because I think you're right. Like people think like, I don't need chiropractic until I'm in a car accident. That's not true, guys. Not true at all. So all the things you just mentioned is like being proactive, right? Mm-hmm. So that's why I see like infants.
Oh yeah, I love working with babies.
Yeah. And I have a question.
Yeah.
So what is that like working with a baby, and it's a brand new baby, and why is that important?
Yeah, the youngest I've ever seen has been 7 days old.
Wow.
Yeah, help with anything from colic, constipation, reflux, ear infections, allergies, trouble with like latching, troubles with like breastfeeding, like with latching, sleeping, head rotation, things like that. I also do craniosacral therapy and fascia release for infants, so helping with like the body work for like lip and tongue ties, things like that. So it's super important. I've seen a lot of babies lately too, and just overall just making sure that they're more comfortable, working on like reflux and head rotation, things like that.
I would love to see that. I love babies, but I would want to see, because obviously you have to be so gentle.
Yeah. It's a much different adjustment than for an adult. I say the pressure used is kind of like checking the ripeness of an avocado or a tomato, and I either use like my thumb or my pinky for the adjustment. So it's much different than what you see online for adult adjustments.
Well, yeah, I would hope so. I've even seen a chiropractic for dogs. FYI, and my friend Pierre, I'm like, maybe I should ask Dr. Briner if she can add that. I'm just kidding.
That's a whole separate certification. I have a couple friends who are animal chiropractors.
Are they here? Because I need to meet
But
them.
I do have a contact where I can help you find an animal chiropractor here.
He's so spoiled. But anyway, going back to the baby. So in my head, right, you being a proactive, like your approach being proactive, like, if you think about all the different jobs out there, like people that are always on their feet, a barber, or maybe you're a nails tech and you're slouching down, you're doing lashes. I feel like these people, who we all need in our lives.
I see like estheticians, hairstylists. I see a couple of construction workers, police officers especially. They wear like the heavy belt all day long and with a lot of sitting and walking, things like that.
Yeah, because I just posted about this recently. Like, so many of us are in the business of serving others, right? Even our waiters, waitresses, bottle girls, bartenders. Like, I want this to be a reminder for them to go see a chiropractor. And then when you're having a baby, not only can doc see your baby, but can you also see the mom after?
Oh, for sure.
And what's the benefit to that?
So I'm certified in what is called Webster technique. So it's a specific technique for pregnancy.
There you go.
So it focuses on all the ligaments, tendons, pelvis, so that as the pregnancy progresses, baby can move and grow without any restriction, but it also helps the mom to be more comfortable as well. So I can see all the way through the pregnancy. So I have a couple of patients who are like 5 weeks all the way to like 40 weeks. So I love working with the moms all the way through the pregnancy. But then after you have the baby, working with the mom, especially in that 4th trimester, because there's not a whole lot of care for moms after they have the baby. It's all then focused on the baby, but nobody's really focused on the mom, and she's a whole brand new person. So I see a lot of moms who have upper back and neck pain, numbness and tingling, pain in the wrist, because now they're holding their brand new baby. So we got to focus on all of that as well.
And then obviously moms, you always put your health last because you're so focused on the baby, like you said.
Yeah, but you have to show up for yourself so that way you can show up for your family, because if you're not taking care of yourself, you're not going to be there for your family long term.
That part. And so,
real quick, my sister had numb hands while she was pregnant. Is that part of it too?
It can be, yeah, because it causes some swelling within like the carpal tunnel for sure. Yeah, so I can do a joint can be adjusted. So like shoulders, elbows, wrists, knees, feet, jaws, sinuses, ears.
One time Doc came to my, what is it, a wedding shower? Was it?
Your bridal
shower. And my nose just would not stop. Like, it was embarrassing. And she came around and she adjusted my earlobe. Never in my life. And it actually felt so good. I mean, I feel like I need it again because from flying, I'm like still clogged. Yeah, no,
the allergy congestion.
No, because it'll like release. You're like, oh.
With the allergy congestion, especially.
But also, Doc, with the senior community, you can also see them, right? Yeah. And then, with that, what do you focus on with our seniors?
Especially with seniors, I take an X-ray so I can see exactly what's going on. Like I said, posture-wise, I look at like the neck, degeneration areas like that. Okay. Yeah, so I mean, as people get older, it tends to be an increase in degeneration within the spine. So I want to make sure, especially people who've had surgeries or fusions or things like that, it's important to get the X-ray so we can see where to adjust and where not to adjust.
So many people, though, are still scared of chiropractic. Chiropractors, chiropractic. Mm-hmm. Why is that?
I think part of it is the noise. I mean, they hear things online. I mean, there's so many videos out there right now about chiropractic and adjustments, and I'm different than most chiropractors. So whenever I do an adjustment, I have a specific technique that I do. So I don't just adjust everything. I don't have everyone just come in, lay down, and just adjust everything. So when I adjust somebody's neck, it's either sitting in a chair or laying face down. I will never have you lay on your back and just like twist your neck. I don't do that. I don't just like adjust both sides of the lower back because it doesn't need it. So I find the specific areas that are out of alignment and we work on that because your body doesn't need everything adjusted. You may feel pain on one side, but that's because it's compensating for what's going on the other side. So I find where those misalignments are.
Right. See, guys, and then for my friends in property management, okay? So these amazing professionals, especially leasing people, they're showing apartments, going up 2-3 flights of stairs, delivering notices. So they're constantly on their feet. And they're always showing up for everyone else and helping everyone else. So that's why like this video will be important because I have so many friends in that industry and I always tell them, you need to go see a chiropractor for preventative, right?
Yeah,
and you
self-care is so important and that's a really big part of self-care. So even if you go to the doctor, you get your checkups, they check your heart rate, your blood pressure, all of that kind of stuff, but there's nothing they can do to check your nervous system. And your nervous system controls all of those functions. So if you're not checking your nervous system, they say you have high blood pressure, well, the brain's not properly communicating with the heart. That's why it doesn't know what to do on its own. So we want to make sure that the brain's able to communicate with the rest of the body. That's its job.
Right.
So my job is to restore your body's ability to heal and function. So I just remove the nerve interference so then your body can heal itself. So you're doing all the healing yourself. Your body knows what to do. It just needs a little bit of help.
I just love how passionate you are about this stuff, and I'm lucky that we're in the same BNI group and she's actually our president. But yeah, I see that passion and I appreciate it. Why is that? Like, why are you so passionate? How did you get into medicine?
So I wanted to be a chiropractor since I was like a freshman in high school. My mom got in a car accident and I went with her while she was getting adjusted and I was kind of like, I want to do that. And then so that was the freshman year, and I didn't actually get adjusted myself until I was a junior in high school. I swam all the way through college, but when I was a junior, I was swimming and I like pulled a rib out of place, and it got so bad I couldn't even lift my arm. Like,
wow.
I was swimming, all I was doing was kicking, and the trainer at school, nobody could help me until my mom took me to the chiropractor and he was able to adjust my rib. Like, it really hurt, but then I went, but I thought at that point too, it was just about back pain. I had no idea.
So much more.
Yeah, so then when I got to school, I was like, oh my gosh, the body is amazing. Like, it can do so much more than just pain. So that's why I just started to become more passionate about that. I just want to be able to help people without drugs, without surgery. Like, there is a time and a place for everything, but trying a preventative, more holistic approach first, making sure the brain's able to communicate. And sometimes people, like, pain is the last thing to show up and it's the first thing to go away. You're not going to feel better right away. You may start to feel better, but our bodies are not, I like to say your body is not Amazon Prime. It's not going to go away right away.
Can you repeat that? What'd you say?
Your body is not Amazon Prime.
Okay.
It's going to take more than 2 days to feel better. So that's why I like to say.
And no refunds, guys.
Exactly. That's why I like to say, like, it's so much more than just that pain and discomfort. A phrase I heard just recently was going to the chiropractor for just pain relief is kind of like using your smartphone to only tell you the time. There's so much more that we can help with.
Right. So I want to call on like the UPS drivers, FedEx drivers, USPS, Postal Service. You guys need a chiropractor. Yeah. And I'm giving you one right here. Yeah. So I
also take most major insurance companies too.
And cash pay. So, right, obviously she helps with car accidents as well. And we'll put all her information here so that you can find her. But do share your location because you're in a very unique location.
So we're in like the Chandler-Ahwatukee area on 48th Street in Chandler. So right off the 10 and the 202 where they meet.
Okay.
We're next to the Kohl's and behind the CVS.
And they're not far from Mills Mall, I want to say.
No, we're just down the street. We're on the border of like Chandler, Tempe, Phoenix, kind of all right in that little area.
So if you're around that area, you work around that area, live around that area, this is your doctor right here.
Yeah.
So going back to that passion, right? So did that passion help you in school? Because if you wanted to be a chiropractor freshman year, that was already in your head.
Yeah. Well, I went to college knowing I wanted to be a chiropractor.
You knew that. Never deviated.
Nope. I mean, at times, my freshman year, I was like, wow, biology is so hard. But I really sat and thought about it, and I was like, there's really nothing else I want to do. I'm not going to change what I want to do. I know I want to help people. I got to figure out a way to get through some of the hard science classes, but going through all of that, and then I ended up graduating early too, so...
Overachiever. I love it.
I did 3 years of undergrad and then I transferred and I finished my last year of undergrad with my doctorate, and then I graduated 3 months early from that as well. So.
But really, kidding aside, I think that's driven by your passion. Like you knew. And it's okay if you don't know yet, but it's nice and it's unique and it's a blessing and it's powerful when you know early on what you want to do.
Yeah.
And obviously we get to be the ones taking advantage, or not taking advantage, but reaping the benefits of you having this passion. But when you were going to school, like how much of that helped? Like, because there's going to be college students still listening to this. Mm-hmm. Like, any advice to them and how to, go through that? I mean, it's hard. You said that.
I mean, and during school, I did like 220 hours, give or take, of seminars outside of school as well. So it's like, I knew what I wanted and I didn't stop. I just kept going for what I wanted. And
did you have a social life during college?
So I swam, like I said, I swam all the way through college, like in undergrad. So it was like, had friends and things like that in there. And then when I transferred, I mean, honestly, it was a little hard. It was a little stressful in the beginning. And I was like, and then I kind of, you work through the stress. I feel like you work better ways to manage it, and then making friends and things like that. It's hard to make friends when you move to a new place, and when you're starting something new, stress is a big part of that, which is another reason to get adjusted, to help calm your nervous system down. But making sure that you go for what you want and don't let anybody tell you different.
Wait, you were saying that, I want to remember actually what we were saying, like the nervous system, it helped you too with what, anxiety or like?
Oh, it can definitely help with anxiety. If you feel super anxious and you're in like a fight or flight, like then getting the adjustment is able to help calm your nervous system down.
I wish people knew that. Like we need to, like I'm going to promote this one as much as possible because I really just want people to have access to help to
Yeah.
make their bodies better so they can function better, be showing up for their family work, you know? I feel like they
because
deserve
if you're
that.
you're go go go. You want to make sure you're showing up for yourself, so you can show up for your family and your business and everything.
So I
that
have
you,
you
do.
and I have Dr. LeBaron too, who
Yeah.
adjusts me, and Dr. Conway.
Good.
And so I
Good.
need to
as long
see
as
you.
as long as you're getting adjusted, that's
Yeah.
all that matters.
Yes, because I mean, and I've been a victim of a car accident,
Yeah.
so I know what you guys do and how
Yeah,
important
for
it is.
sure.
So, but going back to, so after college, right? And was it easy for you to just open up your own business?
No.
And I'm asking that for the rest of them.
Yeah, no, it was not. So after undergrad, or I went from undergrad to doctorate, and then I went and I practiced in another state for a year. I worked for somebody else, and I got really good like clinical experience. I did almost like 5,000 adjustments in a year. They were a busy practice. I just didn't want to live in that state anymore, and my family had ended up moving here, and I was like, I was kind of tired of living in the snow if I didn't have to. So even though the summers are super hot here, but I was like, I've always kind of wanted to live in Arizona. And so I have a business partner. So I was able to kind of help me open up a practice and slowly learning the business side along with that, which has been good. So we've been open almost 2.5 years now. So in December will be 3 years I've lived in Arizona and 4 years that I've been a chiropractor. So
And
super
congrats to that.
excited. Thank you.
So what advice would you have for them? Because I know you're super active, but like there's going to be people graduating or already graduated this last May, next year again, you know, and I want you to tell them, like, what are some of the key things that you did that they should also consider doing when they graduate if they're trying to open up their own clinics?
So opening up your clinic, one thing, do it where you want to live. Like, I mean, just find the area that you want to live in and then go from there. I mean, if you know you don't want to live in that area, but like you really want the experience, that's fine too. Like, so that's kind of what I did. I got really good experience. I knew I didn't want to live there long term, but I was then able to find an area that I really wanted to live, and then I opened up there because I was like, I want to be able to enjoy my life outside of school. I didn't know what hobbies were. I didn't know anything going through school. I just, on the weekends I studied and I went to seminars, and I was like, okay, now this last couple of years, I've really been finding like, what is it that I like to do and be active and outdoorsy and all those kinds of things. But I didn't know that going through school. I was like, what's a hobby?
Right.
What do you do when you're not studying? So then I kind of started to look
So
about,
now you have the
like,
balance down.
so then I started to look about like, what is there to offer in the town, in the city, things like that are outside, having that work life, not necessarily a balance, but like a rhythm, like being able to do both.
I like that, like kind of understanding where you live, if you want to live there at all, first of all, and then what are some of the things that you can get involved with in, you know, so that it, because you can.
Yeah, and this whole last year, I've really started to get involved in the Jewish community here and just meeting new people that way. And there's a lot of events that way, and just making new friends and BNI and just making new friends in any way that I can. I mean,
I would say that's a big thing with you. You always understood networking and marketing. So kudos to you for that. Because
I mean, honestly, I just renewed for the 3rd year within our chapter, and I remember going to the first meeting, and I remember sitting in the corner like, oh my God, I don't want to talk to anybody. I was like shaking, and now being the president and being able to stand up in front of everybody, I hated public speaking, and now I'm like, cool, I talk to everybody. And I think with what I do for work, talking to people every day, all day long has helped me like realize that. And when I talk to somebody and I sit there and I go over like a detailed health history, and I'm like, I'm going to change your life. Just give me time. Like,
right.
I'm going to come up with
that.
like a game plan that's going to change your life. Like, you just got to give me time. Like I said, it's not going to happen right away, but we're going to change your life.
Share a story of like, you know, a couple of your like patients, obviously without the names, but like, you know.
I have a gentleman, he works, he's like Medicare eligible. He works at a grocery store, like stocking, things like that. And he doesn't feel like he's getting as better, but I'm like going through his progress reports. I'm like, you're getting better. We're working on it. He couldn't even like lift his arm, and he was going like this. And he's like, now I can touch my shoulder. Like, super big win for him.
See,
like,
guys?
he's like, it makes his day. He's so happy about it. I'm like, I told you, we're helping you. We're getting better. It's just taking time because it's been there for so long. It's not going to go away right away. Like, even though you may feel something just came on like right away, you bent down, you picked something up really quickly, and it was like, oh my gosh, like that's when it just started. But the problem's kind of been building, like car accidents, like those are major
Injuries
traumas.
at work,
But minor
sports.
traumas, sitting down too long, standing too long, bending, twisting, turning, those all add up to big traumas as well.
Right.
So-
Any other stories that you can share that you really
I just had a mom had her baby. She came in, was it last Monday, and she came in for a massage adjustment, and then she had her baby the next day, and I was like, oh
what?
My gosh, like, and she said like the labor was super easy. It was just a breeze. She was like everything felt like obviously going through labor, having a baby, but she was like it was not nearly as bad as I anticipated because I'd been getting consistently adjusted. So I'm super excited.
So she was getting adjusted while pregnant?
Yeah, I saw her through like almost her entire pregnancy. Yeah.
You can get adjusted while you're pregnant.
Yeah.
And so the benefit of that is?
Just making sure that as the pregnancy progresses, baby can move and grow without any restrictions. So we checked the tailbone, pelvis, all of the ligaments, especially the round ligament, which is a ligament that holds the uterus to the pelvis so that there's no restriction as the baby is growing.
So to my pregnant friends, you better go see Dr. Briner.
Yeah.
I had no idea. Justin, did you? Okay, he's shaking his head no. I'm getting an answer back there. But yeah, that's so good to know. I had no idea. We have to promote that. See, that's a perfect
And then
reel.
getting to meet the baby after, and like it's just such an honor to like be a part of their health journey.
Right. So you kind of shared a lot of that already, but like I want to ask, like, what is like your deepest why in all of this? Why do you do what you do?
I wish I would have gotten adjusted sooner. I wish I would have known more about it when I knew. So like starting as early as you can. Honestly, going through school, I thought I wanted to work with just athletes. But then as I was going through school and I took a pediatric class and then I took the advanced pediatric class and then I took the pregnancy, like the certification for Webster while I was in school. And then my first year in practice, seeing all kinds of different people, I realized like, I love seeing everybody, but I love seeing the families and the kids and just have the whole family come in. And we're a really fun, family-friendly office. So we've just got whole families that come in. Like a couple weeks ago, I had like 4 families all come in, like one after another. And it was just a big fun, like, let's adjust everybody. We've got stickers in the office. We love to hang out with the kids.
She has snacks in the office, guys.
So I just love helping people. I want to help people because some people don't realize there's another way.
Right. I love that. And I'm really glad I got to meet you too.
Yeah.
We're almost done here. I'm getting the signal.
Glad I got to meet you too.
What's that?
I said I'm glad I got to meet you too. It's been almost 2.5 years.
Thank you. Over coffee too. Yeah. I still remember when we met. I think we didn't shake hands. I think I hugged you.
Yeah.
Yeah. I'm a hugger. Anyway, before we end the episode, I wanted to give you the opportunity to maybe highlight and thank some of the people who've been very inspirational and helpful to you throughout your life, and maybe leave them a message.
I mean, I would not be here in Arizona if it weren't for my parents.
I'm sure they're super proud of you.
Yeah, they were able to help me transition from moving from state to state all throughout my different schooling and things like that. And my family's just been super, super helpful with everything, and I'm very grateful for that. Very thankful for my business partner for helping me through learning the business side of everything.
He's pretty awesome. I've talked to him a few times. So.
Yeah. I'm thankful for everybody in BNI, like helping me through and just
integrity, baby. Just kidding.
Like
Not kidding.
I'm just so thankful for just everything here in Arizona and just meeting new people and making new friends and networking. And I have a whole table of like business cards in my office, and I had a patient in there the other day and she was like, wow, you're literally a one-stop shop for everybody. You know so many people. So It's just really cool.
And you started not knowing anyone, guys. Remember like what she said, she started not knowing anyone. And now you literally are.
I was like, I want to know people. I want to know like, I got you. You need somebody, I got you. Kind of like you need someone called Christina, right?
I think, Doc, that you came to Arizona, you hugged it, and Arizona hugged you right back.
Yeah. I love the landscape and just being outside and just,
Well, invite everyone to go see your clinic one last time.
Yeah, for sure. We're on 40th Street in Chandler. Right behind the CVS next to the Kohl's.
And then we'll put her handle on here, all the things. And then what's your phone number?
Our office phone number is 480-256-1421, and we're Connected Health Phoenix.
There you go. And her cell phone is, I'm just kidding. I'm kidding. Guys, thank you for tuning in. Doc, thank you for coming.
Thank you.
We'll see you next time at Connect with Christina. Bye.